Hit me baby one more time. Hi guys, welcome back to my channel. This is Untitled Chapter, your nurse in charge. So, in this vlog, we are going to talk about Britney Spears. By the way, before I'll bring in the intro, please don't forget to click like, comment on this video, and subscribe to my channel. Also, you can access those other videos which are related to the nursing reviews and health teachings. So, let's start after the intro. Actually, hindi ako masaya. Pero, I'm still enjoying the music. So, bay na lang kayo. Hit me, baby, one more time. O, diba? 90s kids. Nandun lagi yung Britney Spears. Diba? Parang lumaki kang Britney, ganun. Tapos yung nanay mo dati, tinatula-tularan niya yung damit ni Britney, pinapadamit sa'yo, ganon. Tapos pagdating mo sa kanto, pinapatugtog yung music ni Britney, ganon. But unfortunately, to change that mood, na-abuse nga ba si Britney? Or does her family really use her for just monetary things? We don't know. But today, actually, nakita ko sa mga news, a sad news about this case of Britney na nagkakaroon sila ng rally for Britney and hindi natin masisisi ang tao because there are a lot already na nakikita natin pinalabas, pinost ni Britney na it seems like she's crying for help. But people didn't notice it until she had the courage to talk. It takes for her to get herself and talk to the public. She was really trying it before using her platform like the Instagram, but it seems like kokonti yung nakakita na she's crying for help. Abused or not abused, we need to consider patient safety or individual safety. And let's have it occur as domestic violence. In her side, hindi naman kasi natin talaga mapag-iisipan na there is an abused part because her race doesn't show it, her social status doesn't even reveal it, and even her economic status doesn't show it. But when someone cries for help, let's help. Domestic violence can give willful intimidation, physical abuse, emotional abuse, sexually or other abusive behaviors to a person or an individual. This is regardless of the age, the race, the ethnicity, the social background, even the economical status of the patient. It's regardless of them all. Let's not consider those things. Because if we speak for abuse, it is a public emergency. Violence against women is accompanied by emotional and controlling behavior due to dominance factors, which can really result to physical injury, psychosocial injury like PTSD or post-traumatic stress disorder, miscarriage para sa mga kababaihang buntis, low birth weight para sa mga bata, self-harm para sa lahat ng mga biktima, and even suicide. So, domestic violence is a public emergency because this can lead to death. So when the news came out about Britney, it seems like the public is really affected because of course, she is a public figure. How much more kapag ang tao hindi siya public figure at hindi siya nakikita ng mamamayan. So let's consider, there are still a lot of people being abused but they are still silently working on their own, silently crying in the corner. Let's think about this. If Britney Spears came from a high level of socioeconomic status and even a celebrity, paano na lang po yung mga nandun sa sulok-sulok ng ating bansa? And let's consider that we really have a low focus and concentration to the abuse na nangyayari sa ating bansa. Good thing that there's already a social media wherein we are already freely crying for help. But what if that individual is guarded with rules that she cannot talk and she cannot express herself? I know there's a lot of people having this one. So if you are one of those people who are emotionally abused, physically or psychosocially abused, comment down below so we can help you in our way. Moving forward, as I've mentioned earlier, this is a public emergency and as nurses, action must be immediately taken. So as nurses, when you see a friend suffering from abuse and you are a nurse, huwag ka nang magpatumpik-tumpik pa. Do your role. Do your responsibilities. And remember, always think and act like a nurse. And use your nursing thinking. Number 1 is, if an individual or a patient is already calling for help and you identified it as an abuse, always make sure about their safety. Kailangan mong ilayo ang pasyenteng yan sa mismong abuser. How are we going to do it? For example, sa community, you can give the cell phone number or the contact number of your barangay officials. And in the community, you can give her a map where is the safe place to go. So remember, kapag meron kang nakitang mga pasyenteng na-abuse na, importante pong ilayo natin sila sa mga abusers. Maybe these abusers are part of the family. The thing that we need to do is to give at least the contact number of the barangay officials from your community. Or maybe other resources that the patient can go and ask for help in the community. Number 2 is to assess for the patient. You must know, or once you see these signs and symptoms already, you are already alert to activate for help. Check for any physical injuries. At kapag walang mga physical injury, ang gagawin natin, i-assess po natin ang pasyente. We are going to assess for the stress level of the patient, how the patient talks, the sleeping disorder, anxiety, the eating disorder, any suicidal attempts, and so forth. So you can see some bruises or laceration sa kanyang kamay. Pwede rin yung mga hematoma or yung namuumuong mga dugo sa kanyang braso o sa kanyang legs. Pwede rin po yun. And if you are already suspecting for domestic violence, apply for therapeutic skills. Listen to the patient and read between the lines. Usually, ang mga pasyenteng to, kapag nandyan pa rin yung abuser nila, they will not talk until such time that they will build trust in you. Kailangan mong magkaroon ng good rapport, yung tinatawag, or yung magandang komunikasyon sa pasyente. At kailangan mo ding ma-build yung tiwala na yon in order for that individual or for that patient to talk. Acknowledge their feelings also. If they are crying, let's just show our presence. Magpaalam tayo bago natin hawakan ang kanilang mga braso. Gawa nga nung baka kasi na physical injury sila, syempre natatakot sila na baka mag-inflict ka din ng pain sa kanila. So it's better show your presence to them. At magpaalam ka muna bago mo sila tapikin or i-hug. You need to empathize for this patient. Isipin mo din, what if you are in that situation? What if you are Britney Spears and you know that you are governed by rules? It's painful on her part because her family members are the alleged abusers and she's crying for help to the public because of this emotional abuse and even physical and sexual abuse sa kanya. And the last part is, at the end of the day, the patient will still decide on her own. So you need to validate her decisions and give her choices. So these are the things that you need to do in order to help an individual suffering from abuse. The thing is, let's always prioritize safety. And remember not to give any false reassurance for this patient kasi sawang-sawa na sila sa mga reassurances. The thing that we need to do is an immediate action. So I guess that's all for this video. Thank you so much for watching. If you are having a friend or a relative who is suffering from abuse, please help them. So in conclusion, everyone can be a victim of abuse, but everyone can help that abused individual. So I guess that's all for this video. Thank you so much guys for watching. If you have any comments about abuse and if you've suffered from abuse already, let us know kung paano ka nakalabas sa abuse na yan. May tumulong ba sa'yo or sarili mo lang ang tumulong sa sarili mo? Naway magkaroon po tayo ng masiglang pamumuhay. Thank you for watching. See you again on my next video. Bye!